So currently there are 63 active cases of coronavirus in Victoria. 11 new cases were announced in this morning's report. 9 of these are locally acquired. 6 we announced yesterday as having coming through shortly from the night before its cut-off, and there are therefore 3 that I can newly announce today in addition to those 6 previously reported yesterday. 2 of these 3 are primary close contacts who were quarantining during their infectious period, which is good news. 1 is still under investigation. They are not a known contact and are not directly linked to any exposure site, but there is very close proximity to that exposure site, and we're confident that the investigation that's ongoing will uncover further crossover points. Our public health team are actually seeing more and more of this in this particular South Australian hotel outbreak playing out a bit differently to earlier outbreaks. There is evidence of casual acquisition instead of those in direct close contact like friends at a pub, family members, and I'll get the COVID response commander to report in more detail about some of our specific priority concerns in this area. I can also update Victorians that the aged care case yesterday, the first one, the R-Care worker, the genomic sequencing has confirmed that that case is directly linked to the South Australian hotel outbreak quarantine, and that is at least confirming in our mind that this is all the one related cluster from the South Australian hotel breach. I'm also able to advise that all staff and residents at Blue Cross Sunshine Aged Care Facility have tested negative, other than that one case we reported on yesterday. That was the crossover worker between R-Care Maidstone and Blue Cross Sunshine. There have been no further positive tests at R-Care in Maidstone as well. Of course, these sites remain under strict infection and prevention control measures, and I want to particularly thank the Western Public Health Unit for leading that work, and I want to thank again the wonderful clinical staff and particularly the nurses from both Melbourne Health and Western Health who have stood into these important infection prevention and control measures, and to support both those facilities as a result of their own staff having to be furloughed and quarantined.